So you're going to reveal now the front of the leg. So I'm just going to get this back on there for you. Okay, same thing that you would do is Swedish, warm her up. Now, even as I just put that oil onto her there, she is boiling hot in this part of the area, so I just have to take note of that. She's a little cold down here, especially compared. So we're just going to try to kind of warm her up and move some of that energy. Now these are getting back into some of your Swedish stuff, so just, you know, get some of that energy moved. And warm it up. Okay, once you're warm enough, you're going to get into a deep palmar glide, starting at the upper sheet border, down to the thigh, to the knee. Careful about the pressure on the knee. So at first, I might not go as deep as I will later. Now, as I'm gliding, her body is giving me a little bit of a resistance, especially in this area here. And so I just pay attention to that. Start again. Again, it's doing it again, and it's kind of like it's vibrating underneath my fingers. So I haven't gotten really deep. I'm just still, you know, working with it. So I'm just going to come up a little bit on that muscle. Again, underneath, it just feels like it's vibrating underneath my hands. And I'm just going to lightly go with it. And what I'm doing here is just warming up in between. There. Yeah, now our body's letting me in. You can tell too, because my hand starts to glide even easier. Like now it's just kind of moving down her leg even easier. And now my fingers, it's funny, as I'm going, I can all of a sudden now feel where the real issue is. And there's an issue right in here. Can you feel it too?
A little bit.
A little. Okay, so it's letting me in a lot more though. Mm-hmm. All right, so then we're going to warm her up again and get into there a little bit now with beating or pounding. Okay, and again, you're doing it mostly in the meaty area. Like tenderizing some meat here. But it's working. Like now even doing this, you can feel the muscle. It's easily moving. It doesn't have the heat temperature that I did when I first started. Okay. Now we're going to get into thumb kneading around the knee. So just be careful around the knee, especially if they've had any issues. Nothing saying I can't lift her a little bit more with my fingers from behind. Just in here, it's just because I can feel something going on that I'm just going to work it a little. Make sure it's warm. Some people are very ticklish around the knee, so you can slow it down and just go into some moves. Again, protect your thumbs. If your thumbs aren't strong enough, just be careful how you're doing it. Do a little bit bend of a finger, change from the thumbs. Now in baseball, people might have ratcheted out their knees, right? When they twist from their hips and their knees are moving too. So just be careful in here. So the muscles might be really tight. So just pay attention to those muscles. And what we're trying to do is strengthen, like empower the muscles to give it more energy. But you also want to lengthen this muscle too. So here we're going from origin to insertion. Okay, great. And then we're going to move down to the front of the calf. Warm it up. So we're going to get into the outside here, just protect the leg from moving, and I'm using my elbow. So it's kind of just running along the muscle and not on the bone. And I always like to end with a fourrage. And then you're going to work the other leg. Just cover up this one and work the other leg. Now with it, all I'm going to do is just reveal her shoulders a little bit here and just cover her up so that I can get in to the area. Okay, so I'm just going to roll that in. And we're going to just tuck you. Yeah, we're going to tuck it along here. Maybe just bring your arms over if you don't mind. Okay, we'll do the same with the other side too. Just... Great. Is that okay? Mm-hmm. All right. So we're now working into the shoulder area. Now, if Kim was a guy, we could work it a little bit differently too, but you're still just going to apply oil like you normally would, so like European lymph drainage. Just make sure it doesn't cross their face. And I just have the pillow over her eyes to help her there. Okay, so now in this situation, what you're going to be working on is also the pectoralis muscles, which is up into the upper chest here. Now, as a female, it might not be quite the area that you're going to work compared to a guy, okay? But you got to remember, in baseball, when somebody takes the bat and they're swinging, and if you want to, just imagine yourself that you have a bat in your hand and swing, and check out which muscles that you would be paying attention to. So if I'm going to swing, okay, they're all up in here that I'm going to be working in this area here. Okay, so we're going to get into fingertip compressions. Okay, so I'm just going to warm up the area though. Make sure it's okay. Because again, we still have to warm it up. So what I'm doing is getting into the pectoralis muscle up in here. Okay, and so I'm just going to have to take a breath. Blow out. And I'm just going to do some compressions. Okay. Again. And as she blows out, I'm going to kind of press in. And even there, now, you even can feel that let go, even though she didn't really have a problem there to begin with, but you can feel it, like, and even see it let go a bit. Now, the hyperemia, when the blood comes to the surface, you're going to see that it kind of gives a red effect. That could be normal too for people. Okay. If I'm going to work one side at a time, I can get my fist in here, and again, if it's a man, you'd be able to work this a little bit differently, so just breathe it in case if you feel it. Okay. Okay, we can go opposite direction. Again, breathe. flatten there. Huh? Okay, again, breathe. Okay, to move into it a little bit more, we could just pull the arm a little bit more out. Okay, breathing in. And again, depending on the client, how much you can actually get into that area and how hard you can get into it. Okay, and then you're going to work the other side the same way. Okay, so from chest to shoulder, just moving into that muscle and then coming in. And it's kind of, I'm rolling with this part of my hand, so moving down, in, okay. So I'm not putting, I don't want to put too much pressure on the heart going straight down, but it's moving it from here to here. Okay. And then when you're stripping, you're coming, well, then I might do the opposite side when I'm stripping. And then when you move the arm, you can strip in there. So I'd be actually from this side going and then just strip like I had done. Now, when you get into doing the arms, because of course in baseball they're going to be using their biceps and everything too, so you're going to want to just do an ELD. Just do a typical ELD. So you're going to finish with the neck. So I'm just going to move your hair out of the way a little. Now, her pillow might fall off, so let's see what happens here. Now, I'm just warming her up. I'm just using the back of my thumbs just to warm her up a little bit into the neck area. And so you're going to fingertip glide with both hands along the sides of the neck. Now, my leg is still on the table here, but I'm going to just glide from the skull to the base, okay? So from the skull to the base. And so my fingers are doing the massaging and doing kind of feeling the muscles in there. She actually does have a little bit of a tension in her neck, not oodles, but a little bit. Okay. Now, I'm going to hold her head in one hand. I'm just going to lightly take the pillow off. I'll leave that so the light's not so hard on you. And we're just going to fist glide, okay, into the side here. Now, not everybody can you go deep, so just do it the best that you can. Okay, then we're going to get into the other side too. Yeah, this side's a little tighter on her than the other. Mm-hmm. So I'm just going to work this a little because it's a little tighter in here. So just warm it up. You can feel it go. Like it was, I mean, it's still there a little bit, but, okay, so we're just going to lightly now with the fist. Okay, do what you can. Make sure that you're doing it to the client's ability and that their pressure. Now what I'm doing now is fingertip kneading to the base of the skull. And this actually should feel good for them. I'm just following the ridge there at her skull. And just having my fingertips just moving in there. Great. And you're finished that massage.